The following presentation is sponsored by the Alabama Department of Mental Health, Lifting Life's Possibilities, and Southern Coast ATTC, unifying science, education, and services to transform lives.
What is risk rating? Do people remember when we talked about what is risk rating? Risk is multidimensional, and we know that there are how many dimensions? 6. We also know that it's biopsychosocial in nature. ASAM does not replace the DSM. Remember that? Even though we have a level of care that does not require a diagnosis, for all of the other levels, we continue to need a diagnosis, and as clinicians, we need to be able to do that impression. So, we know that it's multidimensional, we know that it's biopsychosocial, and we know that it relates to the person's history. If you were to go into your doctor's office and they say, "What is going on with you?" you tell them. But do they ask for a history? Of course, they want to know what's going on. They want to know your family history. They want to know what you've had, what medications you've taken in the past. History. We also want to take a look at their current status because that could change on a daily basis. We want to look at the fact that we go from no problem to an escalation of problems. We want to integrate, again, history, ongoing life situations, current presentation, and we want to evaluate each and every dimension independently of the others. Risk rating of 0 means that there is full functioning in all of the dimensions. We also know that a risk between 1 and 4 looks at the various levels of functioning, or in some cases the problems or the impairment. The higher the number, okay, the higher the number is the indicator for the severity of risk, and that's going to help you put people in the right level of care. Now, we're going to go hopefully slow through this, not only for your sake but for mine, because there's a lot of information and I want to make sure that everyone gets the information that they need. When we do risk rating for dimension 1 and 2, we're only looking at substance abuse issues. Dimension 3, emotional, behavioral, cognitive issues, we are now going to introduce a new term for you, which is called risk domains. I'm going to spice it up a little bit. Risk domains. When we look at dimension 4, 5, and 6, we want to address risk not only for substance abuse, but also for mental health. This is when we talk about co-occurring. We want to make sure that we're looking at the person as a whole. Acute intoxication and or withdrawal. Risk rating of 0 means 2 things, or can mean 2 things. Fully functioning, they have a good ability to tolerate and cope with withdrawal, or there are no signs and symptoms at all. So you might have someone who comes into your office who has a history of very, very mild withdrawal. Headaches, diarrhea, upset stomach, sleeplessness, but they've never been hospitalized because they can go home and tolerate and take over-the-counter medications. So a risk rating of 0 is either fully functioning but demonstrates good ability to cope, or there are no signs and symptoms of withdrawal. A risk rating of 1. We're looking at, this is really a 1D. What is 1D? Does anybody remember? Detox. A level 1D is detox. Remember, we're in dimension 1, so we're looking specifically at detox and withdrawal. Now, if you have a risk rating of 1, we're basically looking at, in our fantasy world, 1D. The individual demonstrates adequate ability to tolerate and cope with withdrawal, so there's minimal risk. Now, if we had all of the detox services across the board that we would like to have, a person would probably go to an ambulatory detox if they had a risk rating of 1, because they could be managed in the physician's office. If we're looking at a risk rating of 2, which is a level 2D, what are we looking at? Having some difficulty tolerating and coping with withdrawal. The intoxication may be severe, but the individual responds to support and treatment, and there's no danger to themselves or others. According to the criteria and the way they base the risk ratings, what we're looking at, they have some ability to tolerate. They have minimal risk for the severe withdrawal. And that's the parentheses, the minimal risk for the severe withdrawal. Now, is that make...
There is a risk for severe, that may
right.
not be in it, but there's a risk.
There's a minimal risk for that severe withdrawal. Does that make more sense?
Yeah.
Okay. So if we're looking at someone who has a risk rating of 1, an ambulatory detox where they would go into the physician's office, okay? They don't need on-site monitoring. They need the physician. Risk rating of 2D, we're looking at still an ambulatory detox, right? And get your cheat sheet out right now so we can look at the levels of detox. We're looking at someone who is looking for more of the daily monitoring. Now, the cheat sheet that I'm asking you to look for says levels of detox at the top, and you're going to see all the bullets. Does everybody find that? So the cheat sheet that you're looking for, do you mind if I hold yours up? Looks like this. It's got little bullets on it, and it says individual levels of detox, and that might help you as we go through dimension 1. If we're looking at a risk rating of 3, we're looking at a person who has poor ability to tolerate and cope with withdrawal. Okay? They're going to have discomfort. They have severe signs and symptoms, and they might be a threat to themselves or to other people. And intoxication has not been managed at a lower level of care in the past. So we're increasing their level to a 3-2D. And what is that 3-2D is what? Clinically managed. Okay? And a 3-7 is, how is that one managed? Medically monitored. So you're looking at 2 different levels depending on the severity of the person. If we're looking at a risk rating of 4, you're looking at the a level 4D for detox. We come to the medically managed. They're incapacitated with serious signs and symptoms of withdrawal. There's the possibility of seizures, and we have a very high risk of life-threatening conditions. Right now we're talking mostly, and I'm thinking in my head, alcohol. But what else, other substance might fit into some of these? Opiates, benzos, barbiturates. So it's not just the alcohol. We have to expand our thinking around what substances are we talking about. So you will now have the certification. You can have a detox level of certification based on your detox. How are we doing so far with risk ratings? 0 to 4, and for each one of the levels or the dimensions, we're going to take a look at the specific criteria to rate a 0, 1, 2, 3, or 4. Opiate maintenance has also been included in the ASAM criteria book, and so I included it today. If we're looking at a risk rating of 0, the dose is well stabilized, there's no withdrawal or intoxication. Does that make sense? 0. 1 is inadequately stabilized and there are mild symptoms of withdrawal or occasional use of the opiates or other drugs to compensate for the symptoms. A risk rating of 2 is inadequately stabilized, and there are moderate symptoms of withdrawal or frequent use of opiates or other drugs to compensate for symptoms. Now, for the folks who work in a methadone program, can you see that on your risk ratings for anywhere from 0 to 1, 2? If you're looking at a risk rating of 3, still the dose is inadequately stabilized. That doesn't mean that the dose isn't where it should be. It's that they're not where it should be. Severe symptoms of withdrawal or frequent, significant, and ongoing use of opiates or other drugs to compensate for symptoms. If you're getting to a 4, we're looking at the continued inadequately stabilized, repeated, significant, concurrent use of opiates or other drugs, and such use is unresponsive to treatment interventions. That's specifically for the opiate population. Now, if you have someone that you're looking at who has multiple substance use, can you take a look at different risk ratings under the dimension 1 for their substances? What? You would have to, because someone could be stabilized in one area based on what drugs they're using, and they could be not stabilized in another area. And that would determine where your level of detox might be for them, their placement. Thoughts about that before we go on? Think about that for a second. What do you think?
So based on what you're saying is, an OMT, the risk ratings are ongoing.
Mm-hmm.
Is it one of those things that you would do? Would you do it yearly, or how often would you do something like that? Because I know upon intake it's done, and then
We don't look at it again.
you don't look at it again. And I know I heard you say yesterday about doing new yearly assessments and everything like that. So I'm guessing you would do something like on a yearly basis just to assess their risk rating.
Okay, that's a good question. Do we do risk rating on a yearly basis, or do we do it ongoing? And you're talking specifically about opiate maintenance, but I'm going to talk across the board. Because when you do a risk rating in dimension 1, their risk rating could possibly change significantly throughout treatment. The risk rating in dimension 1 could start off at a 4. If they go into detox, when they come out of detox, we certainly hope that their risk rating has decreased to a 0 at least, or to a 1, where they're maybe in a mild, they're tolerating it, they're going into outpatient treatment or into a residential program. Your risk ratings can be done for staffing when you meet with the doctor to review a case. You could have something on your progress note or on your treatment plan review. For opiate maintenance, you meet at least, once a month, once a week? And depending on where the client is, if there's any problems, any use, you're going to bring that to the doctor and the staff in your treatment team meeting, and you can indicate the risk rating on your progress note. Because that risk rating will also, in some cases, determine a lower dose or a higher dose when you have opiate maintenance therapy. Does that help you at all? So that can help for anyone at any time when we look at dimension 1. Dimension 2 is your biomedical conditions and complications. There's full functioning, demonstrates good ability to cope with any physical discomfort. Now, when we look at a 0 and we say they can cope with physical discomfort, think about your own personal lives. I'm not going to ask you to raise your hand unless you want to, but are there days when you have some physical discomfort, but you are able to cope with that physical discomfort? You don't need hospitalization. You might need ibuprofen, right? So sometimes folks have conditions that are chronic, but they cope very well. That's where the 0 comes in. Or there's no biomedical signs or symptoms present. We're looking at stability, okay? So that's your biomedical under 0. When you're looking at dimension 1, and the parentheses are what the level of care is that we learned about yesterday, The individual demonstrates adequate ability to tolerate and cope with physical discomfort. I know for myself, I can tolerate physical discomfort on some days better than others. However, the symptoms might be mild to moderate, which might interfere with daily functioning. And I just put pain in parentheses because pain is typically one of those biomedical conditions that can impact our ability to tolerate our day and to cope and to function and to interact with other people. So you're looking possibly at a level 1, which is just your general, what we call now general outpatient, what ASAM calls outpatient. So we're looking at the biomedical conditions. When we look at a risk rating of 2, we might be looking at a 2 or a 1. Has some difficulty tolerating and coping with some physical problems, or has other biomedical conditions and complications. They may interfere with recovery and mental health treatment, and the individual is neglecting care of some of the serious problems. What we're seeing here, things like episodes of chronic pain, malnutrition, other things. So the picture is we're going from a level, risk rating of 0 until we escalate up to a 4. A risk rating of 3, we're looking at the poor ability to tolerate and cope with physical problems. The general health of this individual is typically poor. What we look at serious medical problems which have been neglected, and we're looking at things like severe pain, needing medication. We're looking at diabetes. But in many cases, they're stable, but they're having a difficult tolerating with the medical conditions. So we might be looking at a 3-7. What is a 3-7? Does anybody remember? We know it's residential because it's a 3. What does the 7 indicate? Medically monitored. When we look at a risk rating of 4, and remember we're under the biomedical dimension, the patient is incapacitated, okay? Severe medical problems, extreme pain, uncontrolled diabetes, GI bleeds. What other kinds of things can you think of that would help indicate that a person was incapacitated? Severe dehydration, other kinds of things. Pancreatitis, absolutely. Things that have gone untreated. When we look at a risk rating of 4, we're looking at a level 4, which is the medically managed.
Where would DTs fit in here?
DTs, we would go back to dimension 1. And if we were going back to dimension 1 and someone was having those types of symptoms, we're looking at probably a level 4. You're looking at the detox now. I think there are some general hospitals that have acute beds for folks who have severe detox. Yeah, and I'm sure that they're there. I think that probably if you walk in and you're in a detox, you're in a withdrawal and the potential for detox is very high. History of significant seizure issues, you're going to find an inpatient bed. Mm-hmm. And they give you that wonderful little treatment plan. They send you home, please sign here. You can't even see yet. Yeah. So, and see your doctor. If anything happens, come back to the emergency room, and that's how we recycle all the time. Yes, discharge summaries. We want to make sure we cover ourselves. So when you talk about the DTs, we're looking at the other dimension. So if you have a level risk rating of 4 on dimension 1, although you continue to assess the rest of the dimensions, don't you think that that would trump your treatment placement? We want to stabilize this person. If you had a risk rating of 4 under dimension 2, is that going to trump something also? Because we want to stabilize them medically. Now we're going to talk about dimension number 3, emotional, behavioral, and cognitive issues. We have risk domains now, just to complicate it and make it a little more confusing. We have risk domains. Anyone in here ever work specifically in the mental health arena? Okay. You were used to assessing risk domains, which are these. Might not have actually known what the terminology was, but you were used to assessing someone under the risk domain portion of this. There was a conversation that was at one of our TOTs, and I just want to share it with you. I'm going to steal it, but it's not mine. Just disclaimer out there. When I was newly in the field, and for some of those who've been around a long time in the substance abuse field, we asked primarily 3 or 4 questions. Are you homicidal? Are you suicidal? Do you have a plan? And we hoped that they said no, because if they said yes to something, then we had to go do something, right? But that's the way it was back when I got into the field. Under the mental health side, these were very common areas that you address at all times. Thoughts or comments about that? People agree with me? But do you remember asking those questions? Are you suicidal? Are you homicidal? Do you have a plan? Well, ASAM is saying when we look at dimension 3, we're going to take a look at risk domains now. We're going to look at the dangerousness. We're going to look at interference with addiction recovery. We're going to look at social functioning, and we're going to look at ability to care for self and the course of the illness. So we want to make sure that we look at all of the risk domains. Now, we're going to go through these, but I'm also going to give you a cheat sheet. One of the things you want to be able to do is take a look at all of these questions. How severe is the individual's impulsivity related to suicide and homicide? We want to know if they're going to harm themselves or other people. Under interference with addiction recovery, to what degree are they able to focus? To what degree does the individual's substance use or other mental health problems interfere with important relationships in their life, which falls under the social functioning? We look at risk domains under self-care. How well are they able to take care of the daily tasks in their life? And under the course of the illness, does the individual's mental health or substance abuse history affect his or her current issues? What I'm going to do right now is take a look at handout number 7, where I have helped you with the risk ratings under each domain. Here we are in dimension 3. A risk rating of 0 would mean what? They either have no mental health issues or has a diagnosis, but they're stable. There's full functioning in all of the 5 risk domains. If we look at risk rating of 1 under dimension 3, we're looking, do they have a diagnosed mental disorder that requires intervention? But it doesn't significantly impact treatment. You're looking at a level 1 treatment, and you're looking at a risk rating of 1. A risk rating of 2 would place someone in a level 2.1 or 2.5. So you have 2 areas under the risk rating of 2. The ASAM authors were very, very comprehensive when they chose risk domains. If you have a risk rating of 2, under number 1 it says that their impairment is only problematic when you're having an acute episode. If you have a risk rating of 2, they have a persistent mental illness with symptoms and disabilities that cause significant interference with substance abuse treatment. But we don't have a safety issue. And we want to remember to assess all the 5 risk domains. A risk rating of 3. The level of care would be a 3.5 or a 3.7. As the risk rating increases, so does the level of care. We're looking at two areas. The level of impairment is only problematic during acute impairments. We want to look at those episodes. Or they have severe psychiatric symptoms, disability and impulsivity, but has sufficient control, and they don't require involuntary commitment. The risk rating of 4 has severe psychiatric symptomatology that does require involuntary commitment. And that's where you're looking at your level 4. Can anybody give me an example of what a level 4 program would look like under dimension 3 for level 4 treatment? Pardon? Possibly a VA hospital? A psych unit. Are we talking something like Bryce? Possibly? Right. So you could look at a lot of different areas, but we want to make sure that the safety of the individual is addressed. This is an important piece that you need to remember. If there is a risk rating of 2 or above in dimension 3, when you get to 4, 5, and 6, you want to continue to assess for both mental health and substance abuse issues. Is everyone okay with that? Do you understand why? If there was a 0 risk rating in dimension 3, which is your emotional, behavioral, and cognitive issues, then you wouldn't have any mental health issues in what? 4, 5, and 6. Because we've already ruled that out in dimension 3. What I'd like to do, yes, I'm sorry. Would the assessment factor in a history of mental illness? Yes, you would always assess, but what you're going to look at is the risk rating for that individual. But you certainly, remember, we need a history because it's multidimensional of everything that's going on in a person's life. Then let's take a look at dimension 4, which is readiness to change, and our stages of change. And we're going to look at, now, let us assume that we had a risk rating of 2 or above. We're going to begin to look at both the substance abuse component and the mental health component. So if we were risk rating someone for substance abuse, we know that they're willing to engage, committed to alcohol and drug use recovery. That would be a 0. Mental health, basically the same thing. They're committed to change, and they're looking at their mental health functioning and behavior. So they're stable, pretty much across the board for both areas. When you have a risk rating of 1, typically you're looking at a level 1 outpatient program. It means the individual is willing to enter treatment and to explore strategies for changing, but is ambivalent about the need for change. The individual is willing to enter treatment and explore strategies for changing mental health functionings. Basically the same terminology. We're looking at a risk rating of 1 and a level 1. When we look at a risk rating of 2, we're looking at a level 1 with motivational enhancement and possibly a level 2 with case management. Now remember, what I'm saying here is we're using ASAM concepts. That does not mean that that happens in every agency where you can just assign a case manager. Okay? So we're looking at the concepts of ASAM. We're looking at if they have a risk rating of 2, they agree to substance use treatment, able to recognize the consequences, but they have a low commitment to change. And if you have a low commitment to change, where might you fall? pre-contemplation, maybe even a little bit into contemplation, but you're kind of straddling the fence there, so we're looking at a risk rating of 2 for both substance abuse and mental health. A risk rating of 3, you're looking at either a level 1 or a level 2 with case management. So we want to look at a person at level 3 with inconsistent follow-through, minimal awareness, is unaware of the need to change. So those are the kinds of things that we're looking at a level 3. When you get into risk rating in dimension 4, as you're going to see in the rest of the dimensions, we have a 4A and a 4B. 4A, we're looking at not having the immediate need to do something. So no immediate action is required. You're looking at level 1 for motivation plus a level 2.1 for case management. The authors of ASAM are very committed to case management, as you can see. We're looking at taking care of the needs of the individual on all aspects, in all aspects of their life. We're looking at the inability to follow through, little or no awareness, negative consequences have been evident in their life, knows very little about addiction, sees no connection between the two. So as you can see, when we have a risk rating of 4A, we're having an escalation of issues, but the important thing is there's no harm to themselves or to others. We're looking at substance abuse, mental health disorders at a 4A, no immediate action is required. If we're looking at a 4B, we're looking at immediate action is required. And when we do that, we're looking at level 4, 3.3, or a 3.7. Folks, in the substance abuse side of the house, we can take a look at become violent or suicidal, drive under the influence, erratically. We know that a lot of people drive under the influence anyway, but we're looking at some very significant issues. When you're looking at a 4B, we want to make sure that we're taking some right-away action that day. The same thing with mental health disorders. Now, when you're looking at readiness for change, could you have a risk rating of 0 under mental health, but a risk rating of 3 for substance abuse? Or vice versa. I mean, it just goes without saying. You could have a 1 or a 4. You can mix and match them based on the presentation. So we want to make sure that when we start getting to dimension 4, if we have a risk rating in dimension 3 or 2 or higher, we begin to look at these separately. When we look at dimension 5, again, a risk rating of 0. We've talked about that. No potential for further substance use or has low relapse triggers. Okay? Good coping skills. And also with their mental health disorders. Could we have someone who comes into our offices who rate a 0 under dimension 5? Could a person be coming into our office who rates a 0 on dimension 5 because they have been in recovery for a while? People are looking at me, why would somebody come into my office if they've been in recovery for a while? Boy, that doesn't make any sense.
Well,
sure they could. What?
We were doing those exercises yesterday with the, when everyone had to do a situation with an adult and an adolescent with 0.5. Couldn't that be the case as far as a 0 for risk rating? The fifth dimension?
We could, but remember, when we look at the risk rating, if they have no diagnosis, we're really not looking at risk rating. But you're thinking, why would someone come into my office and come into treatment if they have a 0? As an example, had a woman who came from another state, had been sober for a number of months, but had to complete a program in order to comply with her legal issues in the other state. Has a diagnosis, right? Her stage of change might be action or maintenance, but under relapse potential, we're looking that she probably has minimal risk for relapse at this particular time. When we look at a risk rating of 1, typically we're looking at level 1 treatment. Has some minimal relapse potential, some vulnerability. However, they have fair self-management skills, and so we're looking at a risk rating of 1. Risk rating of 2, we're looking at possibly a 2.1 or a 2.5. Some relapse issues, however, they are able to self-manage with prompting, and the same thing goes for mental health disorders. When we look at dimension 5 again, a risk rating of 3, 2.5, or a 3.1. Now, there are some discrepancies, and that goes back to what Al said this morning. So there's some subjectivity in this, isn't there? We need to look at the whole person. It's not just an equation that if I add this to this, I get this, because we have some variables in there. So when we look at a 2.5, do you remember what the 2.5 is? Partial hospitalization. Now, a level 3.1 is a residential program, but it's a low intensity, clinically managed residential. So although they're different, we're not off the charts with the differences. So we're looking at some issues here that would probably indicate a 2.5 or a 3.1. If we're looking at a 4A, we're looking at no immediate action is typically required. We're looking anywhere from a level, believe it or not, a level 1 to a level 3, depending on the degree of danger. We're looking at danger. We're making sure there's safety issues involved. At a 4, we're looking at a level 4, because a 4B would tell us what? If you're looking under substance abuse, we're looking at impulsivity, we're looking at psychotic and aggressive behavior. When we're looking under mental health issues, we're looking at folks who have depression, feeling of hopelessness, a lot of suicidal ideation, possibly with a plan or without a plan. Safety issues. Dimension 6, when we look at recovery environment. Again, we start with the 0. We look, do they have a supportive environment, or are they able to cope with poor supports? Some people will have a risk rating of 0 because they are able to cope even with poor supports. They manage very well. It's difficult, but they have the ability to do that. With the mental health disorders, people sometimes do not have a supportive environment, but committed to being on track with their mental health issues. A rating of 1, we're looking at level 1. We're looking at a level 1 under the substance abuse, or I'm sorry, the mental health disorders. If you have a level 2 risk rating, 2.1, 2.5, or 3.1. Now, why the discrepancy there? Are we looking at things like, what does the client need? What does the client want? Sometimes folks come into our office and what do we say? We know what you need, but they're saying, this is what I can do. So do we have to take that into consideration? Even though we know that the recommendation might be a little higher, they are not able or willing to do anything at a higher level. And we look at both the substance abuse and the mental health. With a risk rating of 3, we're looking at a 2.1 or 2.5 in conjunction with a 3.1. Now, if I had started this on yesterday, first thing in the morning, you'd say, what is she talking about? 2.1, 2.5, 3.1. Do you see where you are today? We are talking a common language, because I can now say the numbers and you are able to relate to the numbers. Now, remember, a 3.1 is low intensity, clinically managed, with a minimum of 5 hours of substance abuse treatment per week. Does that incorporate when we look at a 2.1 or 2.5, because the minimum is 5. At 2.1, how many hours are we looking at? 9 or more? Or 20 when we look at the 2.5. Again, the risk rating goes for A, and it also goes for B. 3.1, we want to take a look at, are they unable to cope with the negative effects of not only their environment, but also their substance use, and the same thing goes with their mental health disorders. When we look at a 4B, we need to take some immediate action. We're looking at a 3.1, 3.3, or a 3.5. We want the residential programming, but we still want to take a look at the level of intensity. We're still looking at clinically managed. You just received a handout, stand over here, like we did for the levels of care. Remember? Adolescent and adult. So you've received a crosswalk. What we're looking at here, again, is the dimensions are on one side. You have your risk rating across the top. Everyone with me? The higher the risk rating, the higher the level of service. So let us pretend that we have a person in dimension 1 who has a risk rating of 3. However, all of their other dimensions are falling like in the 1s and the 2s. What is that telling us about this person? Where might we put them? Can you look there? 2.5? Would we want to take maybe a look at detox? This one doesn't include the detox levels of care, but would we want to? Sure. Let's go backwards and say they have a 0 risk rating in dimension 1, but if we go to dimension 3, we have a risk rating of, let's say, 3 or 4. Are we going to look at a higher level of care? So it depends on our risk ratings and our dimensions. That's why we look at every single one of them. So with that, this concludes the portion of our online course. And I thank you.